All right.
Oh, here we go.
Time to mute.
Here we
I'm
go.
on my walk.
Love you guys.
So I gotta be.
I think the message has become very clear over the past few days that we cannot do what we do. Tamika cannot do what she does. Really, no one can do any of this by themselves. So we are very proud to share a video from one of our very generous sponsors, Roche. I'd like to introduce Nancy Peña, OPN-CG, CMI, BS, a dedicated lead patient navigator at the forefront of gynecologic oncology clinics within the esteemed Dana-Farber Cancer Institute and Brigham and Women's Hospital. With a tenure dating back to 2005, Ms. Peña has been a steadfast advocate for high-risk patients, those with abnormal findings, and those at heightened risk of cervical cancer. Her commitment lies in ensuring these individuals access the right care, offer tangible resources to surmount barriers. Beyond her role, she serves as the director and founder of Navigación de Pacientes Internacional. This organization trains both non-clinical and clinical patient navigators in Spanish, not only within the US, but globally. Please join me in welcoming Nancy to the stage.
Good afternoon, everybody. I'm gonna put this mic here. So first of all, I wanna thank Tamika and her team for inviting me. I am very humble and honored to be here, especially after so many people sharing their story, personal stories, and emotional stories also. So I appreciate that. I have the privilege of being a Latina from Guatemala, a journalist, working as a lead patient navigator at Dana-Farber and Brigham and Women's Cancer Center for more than 10 years. I'm gonna share some slides, but it's just to support my talk so I don't get lost because I get so passionate. And also, I wanna say that after working with Dana-Farber and Brigham and Women's in working in different protocols, educational materials to educate women coming to our clinic, I was able also to adaptate and translate, right, that information into Spanish to train navigators in Guatemala and now in 7 countries in Latin America. I also want to thank Dr. Mandy Pratt-Chapman, who is here, who is from the George Washington Cancer Center, who allowed us to use the patient navigation guide that was in English, and we were able to translate it into Spanish, and we are using that as part of our training, also to, to support others. And talking about training, I'm gonna chat about patient navigator for those who are new to the concept. But you can also access that free training we have at the George Washington Cancer Center. So having said that, I'm gonna ask to, next slide, please. For those who are new to patient navigation, Dr. Harold Friedman, who was the director of the Harlem Hospital here in New York, is the father of the model of patient navigation. He started to observe that a lot of African women didn't follow up appointments and they were dying from breast cancer. So thanks to him, we are having this program. Also in 2005, former President George Bush signed an act, and I'm not gonna read that, allowing cancer centers to have navigators. And now in 2024, the CMS just passed a rule to be reimbursed for patient navigators. So in the last 2 weeks, I have seen more than 20 jobs looking for navigators in different areas. So, you definitely check it out that. Next slide, please. So about stigma, we talked about stigma early, right? We have a wonderful presentation about stigma, but I just wanna break it down. Stigma can be structural, right? It is a negative attitude, belief, and practice that happens in the system, medical, educational, and other areas. Community stigma also is a negative attitude, belief that happens with people in their own communities. And external stigma is also a belief and a practice that is directed towards a certain groups. And internalized stigma is what happened, right? And the belief and negative attitude we have through ourselves. And we are gonna address that. Next slide, please. Also, I found a very great publication in Canada talking about a stigma and how that is a barrier for a woman under high risk cervical cancer and HPV. So you can check out that information, but I like the way they talk about stigma, right? That as a woman, we have our own stigma. We feel guilty, very, shameful, etc. And that's a barrier for women to seek care. Next slide, please. So now I'm gonna introduce you our program at Dana-Farber Brigham and Women's Cancer Center. As we know, Dana-Farber is one of the best places to be treated. We have so many resources. We have resource specialists, social workers, navigators, nurse navigators, etc. That sometimes having so many resources, we can miss to inform patients. Unfortunately, we are not, we are one of the best, but it doesn't mean that sometimes we cannot miss some information, right? And it happens yesterday, right? We have a colleague of us after one of our doctors were sharing about sexual health that unfortunately our colleague didn't have that information. And as a navigator, I just run to my computer, get information from the colleague, and she has an appointment soon. And that's a navigation piece to connect and dots to dots, right? And in our program, we started in 2005, and I was one of the first navigators, was designed to work at the GYN oncology at Brigham and Women's. So in that clinic, it's a colposcopy clinic, and we see higher risk / cervical cancer patients. So almost 90% or 85% of women that I'm working with are under pre-cancer and higher risk. So I'm just gonna, because I'm so passionate, I'm just gonna share with you that we are serving more than, I can tell you today, that more than 2,000 women have been served for our program. Also, the navigator is a process that reduces barriers. So for women to get access to care, and not just women. Right now, navigation, we can have navigators in the emergency room for diabetes, have high blood pressure, etc. You name it. And our job in this process is to work with women, educate them, and help them to understand why they have to follow up so many appointments in our clinic. And it's interesting because Dana-Farber is just one block from Brigham and Women's, and we have a very nice bridge that communicate both institutions. So my job as a navigator is welcome women with respect, with dignity, and educate them about, first of all, I ask them, what are you doing here? Like, who refers you? How much do you understand why you're being referred to this clinic? Second question is, do you have support from your family? And third is, what kind of barriers can prevent you for you to follow up appointments with us as needed? And why is important that conversation at the first appointment? When we started navigation, we were working just with low income and Medicare, Medicaid patients. Today, we are working with all new patients, regardless of financial status, education, you name it. Because we learned in a publication we reduced the no-show rate from the 49% to 29% in the first 7 years. Today, our no-show percent is almost 8%. But that took us a long way, because every time we have a no-show, we were calling and I was observing, and we just rescheduled the appointment. And I says, no, we need to ask why. We learned 26 reasons why women didn't show up. First reason, I didn't understand why I'm being referred to this clinic. Second reason, I forgot the appointment. And the third reason, I have menstrual period, right? So every time women come to our clinic, we had that session of 10, 15 minutes. Also, it's important to mention that, the next slide, please. Also, it's important to mention about stigma, right? When we have women come into our clinic, 100% have anxiety, fear, depression, and terrified. They are terrified. It doesn't matter what. So we address that as a team. I cannot do that by myself. Navigation in our clinic starts from the front desk, welcome people in a nice and warming way, with the medical assistant, with the residents, our doctors, and myself. So navigation here is a process, but also is a team. And one of the statements I have from women coming to our clinic when I present myself and I talk to them, and they disclose a lot of information to me rather than the nursing or with the nurses or the doctors. Some of the statements is, I feel ashamed. I feel judged. I feel dirty. I can tell my husband because he's going to think that I am having another, man. I am upset. Who is responsible for this HPV? How can I protect my boyfriend of having HPV? This is because I have multiple partners, and on the other hand, we have women age 70 and plus saying, I only have one man in my life. How that happened? Is this man cheating on me? So we are having those questions all the time. I am not a social worker. I'm a journalist. I'm a patient navigator. So how to answer those questions, right? Of course, with education, first of all, we talk about how HPV is transmitted. Second of all, we explain today why it's important to understand results and following appointments. And I always say something like, perhaps this is the first appointment and the last, finger crossed, or maybe we need to build a relationship, meaning that when you have the letter with the results from our clinic, you perhaps might have another appointment. Don't get panicked, it's part of the process. And why we had to follow up. So we explain that because we are comparing those results with the next results and following until everything is clear, or perhaps we had to make decisions. And you need to be educated and informed so you can make the best decision for you. I want to share some examples. Next slide, please. This is one of our teams posing for that picture. And one of the other things we do in our clinic is we enroll patients in our patient gateway. Just because you have a smartphone doesn't mean that you know how to use it. Just because you have technology doesn't mean you know how to use it or you want to use it. Also, we have different generational communities coming. So a woman 80 years and plus, perhaps she doesn't want to use a computer or a portal to check results. Can the nurse call me? Sure, we can call you. But going back to the point about helping women coming for the first appointment, and that's why we reduce the no-show. But most importantly is that we want you to have a flyer breaking down potential information about the results, meaning having a loop procedure, what that means, having a comb biopsy, what that means, having a biopsy, colposcopy, etc. So you have this brochure. When you have the letter and the result, go back to this brochure instead of going to Dr. Google and trying to find information there and match the information from the brochure. So now you can have better questions when you go back to us. If you don't get the results, you call me directly and we can link you to the nurses. So that's the way we approach women in our clinic. I want to give you some examples. In the first 2 years I started navigation, I met two cases. It was so remarkable. A Dominican woman from Dominican Republic, she was age 50 and plus, an immigrant without the legal documentations, no Spanish, no job, no family members. She just had a couple of friends, and she was sleeping in the floor of that place, taking care of two kids for her to live there. On the other hand, I have a white woman, a nurse, oncology nurse, working at the Beth Israel Hospital with a lot of experience. And guess what? She was an oncology GYN nurse. I have those patients coming to my clinic the same week. So with the Dominican patient, right? So how we are gonna address those barriers? And the first thing she told me says, Nancy, I feel embarrassed to share that with my friends. You know, I just arrived to United States like 3 months ago. Was bleeding, and to share them that I have this virus, HPV. I don't know. They're gonna think something, really bad of me, saying that maybe I was cheating. Okay, education is a key. So we educate her. We were providing her with different resources, transportation, food cars. But the thing is that she was arriving, she was 50 miles away. She was arriving at 7 o'clock every time. And I said, but your appointment is 9 o'clock, 11. Why are you coming so early? I just walked to the train, winter time. I wait the train, and I just arrived. I said, we have a schedule for the train. Okay, so you can take the train perhaps 9 o'clock. You don't have to walk. We are gonna pay a taxi for you. You don't need to walk. She finished the treatment. She did. We were able to help her, and she bring her son. And the son, right, was helping cooking and everything, and we were able to provide her with some short accommodation for housing. So she was maybe 10 minutes away from the hospital when she started radiation. On the other hand, I had the nurse, and she was working with a social worker and everybody, because she understands resources. So she was asking for those resources, right? So when I met her, and she says, Nancy, I don't know what you're gonna do for me. I says, well, let's talk. How can I help you? I know you are a nurse. Perhaps you don't need education information, because I'm sure you know that, especially if you're working at GYN. And she says, you know what? I don't want to see the social worker anymore. I prefer to talk to you. Okay, great. How can I help you? Nancy, I'm not getting the treatment. Excuse me? I'm not getting the treatment. I'm 75 years old. I want to go back to Texas to take care of my granddaughter. She's 2 years old. I want her to remember me with my hair, my lashes, everything. I don't want to have chemo. I don't want to have radiation. I know what it is that. I see patients having that every day. I am doing that for 30 years. And I don't want to be bold. I'm traveling, I'm living. So yes, I was reading, and I'm like, how about if you go to, I know you're going to Texas, how about if you change your mind, going to MD Anderson? And how about if we just transfer all your medical records, bring your medical records for you in case you change your mind? And she says, no, I already made my mind. I'm not gonna have the treatment, period. She left. But she listened to me, and she bring her medical records and fly to Texas. Other stories, I can tell you, I can be here forever. I have another story, 18 years old, African American with two kids. And excuse me, it's time now? King? 5? Okay, thanks. So about stigma, right? I have this 18 years old African American with two kids, and she was procrastinating treatment. She needs a lip procedure, a major biopsy to remove abnormal cells. And she didn't show up. We called her, sent letters, offering taxi, and she didn't show up. And she showed up a couple times, and she says, I'm not having any treatment. And she was sitting this way, right? So you can read the body language. Stay away from me. And we talked with the doctors, with the nurses, and she's like, no, I'm not getting anything. And I said, why Can I ask you why you're coming if you're not getting treatment? I don't know. I'm not getting treatment. Okay. You understand the necessity of this treatment. We are gonna review again the information we give it to you. No, I understand, Nancy, I understand. I have a higher risk and I'm ready to have cancer, right? Yeah, exactly. I'm not getting, and she left. She come back perhaps 2 weeks later without an appointment, saying, I wanna talk to Nancy. We sit, I didn't even bring my notebook. I just sit with her and says, how can I help you? She says, Nancy, I wanna be honest with you. I am from Louisiana. I belong to a large family. My grandma and my boyfriend are pushing me. Then I had to have at least 6 kids. And I'm behind. I just had 2 kids. So if I have this leave procedure, I'm not gonna have more, other 4 kids. And again, with dignity and respectful, right? No judgment. And I says, how about if you have 2 more kids and then having cervical cancer and you're not gonna be able to raise 4 kids, not even 2. Did your grandma, your boyfriend understand that? Oh, really? Is that serious? It is serious. It is. How about if you bring your boyfriend and grandma and we can talk to them? She did. She bring grandma and boyfriend. We explain and we educate them. We give them the brochures and everything. And guess what? Grandma says, had the procedure. She get the procedure. Later, she follow-ups with us. A year later, she was asking for birth control pills. The second year, she gets back to us saying, Nancy, I'm getting back to school. I'm not having more kids. I am asking to have 2 ligation. And I asked my friend, forget about kids. I had 2, it's enough. So this is a powerful about navigation. Patient navigator can reduce stigma, can reduce barriers, but we need a team, we need a process. The navigators right now, we are professional navigators, nurse navigators, social worker navigators. And again, I was, the next slide, please. I was telling you that, this is my thing. I was telling you that navigation is growing rapidly. And I think I'm gonna stop here because Kim is there. But we have a quote. So I know that when she's there, it's like 5 minutes. So, but I appreciate on behalf of my team, on behalf of our patients, I learned so much from them. And I am very humble and honored learning from all of you. And I am right now thinking I'm going to translate everything I have learned from you to bring them to my clinic, but also to Latin America. Thank you.
Thank you so much, Nancy. If you'd like to have a seat. We are honored to bring up our next panel of speakers, starting with Kimberly Williams, MHCM, a shining example of strength and resilience in the face of recurrent cervical cancer. As a survivor patient advocate, Kimberly's journey is not only one of survival, but of empowerment. Holding the esteemed position of Chief Diversity, Equity, and Inclusion, DEI Officer at Cervivor, she is a tireless advocate for change. Joining her are 2 cervical cancer survivors, Survivor School graduates, and international patient advocates, Karla Chavez and Nymphia Emmanuel.
Hello, everybody. Aren't y'all excited? Okay. I mean, we have had 2 power-packed days, and I'm just excited to be able to sit up here and talk with you guys. Y'all have been amazing. So give yourselves a hand of applause. So we're gonna talk a little bit. Nymphia is excited. Karla, are you excited?
Yes.
Okay, all right. I just wanted to make sure. And so we're going to talk a little bit about health equity and stigma. And I brought my phone up here because I wanted to kind of give a definition, if you will, about health equity. I think a lot of times we look at health equity and we look at it from a black and white standpoint. And so I want us to be able to look at it full circle. So health equity means the attainment of the highest level of health for all people, where everyone has a fair and just opportunity to attain their optimal health, regardless of race, ethnicity, disability, sexual orientation, gender identity, socioeconomic status, geography, preferred language, or other factors that affect access to care and health outcomes. So health equity does not mean a black and white situation. Health equity is looking at everybody and sometimes just where you are and able to access that care. Does that make sense? So when I sit in this position as Cervivor's chief DEI officer, it's a big thing for me. Growing up, I was born in Seattle, Washington. Yes. But I was raised in a small town in Texas, Rockdale, Texas. The nearest GYN is about 60 miles from that city. So you would have to travel like an hour, 10 minutes just to go and, for lack of better words, get your coochie checked. Okay. So you talking about an hour and 10 minutes one way. And so sometimes what you find is people have other things that they have going on. And that's when we talk about that equity, right? And figuring that out. So now as a cervical cancer survivor and sitting in this position today, I'm trying to look at how can we do better and how can we work just like Alabama is working? How can we work to make sure that access is available to everybody? Does that make sense? So we're just going to go around and just talk about why you're here, your little journey. It's a big journey though. And what do you hope to gain in your country, in your community as it relates to access?
Okay. So hi everyone. My name is Nymphia and I'm from St. Lucia. Why I'm here? I'm here to be able to get more information, to be able to learn, and to be able to go back and share with my community and my island as a whole, so that a lot of us can go out there and get our pap smears done, to be able to be more educated and to be not to so that we'll not be afraid though to go out there and get it checked. Because a lot of us think like, you know what? If I go get the pap smear done and it's cancer, how am I gonna afford the care that I need?
Yeah.
So I'm here to just like gain education to be able to edify other persons.
Okay, and Karla. And so what about you? Tell us a little bit about you and what has brought you to the Cervical Cancer Summit.
Well, hi everyone. My name is Karla. I'm from Honduras in Central America, a small country, very close to where Nancy is from in Guatemala. I'm a cervical cancer and thyroid cancer survivor. I also have an ostomy due to RV fistula. I'm here because no one has to go through what I went through. And living in a country where the stigma is talking about anything below the belt, you need to be educated, to be empowered, to be able to express what went on with me in an educated way and a way that you can educate other women to go get their screening, to be able to talk about it, and above all, get vaccinated, get our kids vaccinated.
Thank you. Thank you. And so now as we talk about cultural stigmas, and stigmas can range from different things, which can include denial of care. So not just the stigma that we think about as cervical cancer survivors, but it's cultural stigmas could be that you were denied the care that you needed, or receiving substandard care. So from your experience, and you can chime in too, Miss Nancy, from your experience, Nymphia, what kind of cultural stigma do you feel like is in St. Lucia?
From my experience, I think the cultural stigma when it comes to cervical cancer is that our healthcare provider to not do enough, meaning they would not, like January Cervical Cancer Awareness Month. When I had a Zoom meeting, I had an opportunity to talk at a Zoom meeting, and a lot of them did not know that January was Cervical Cancer Awareness Month, much less what cervical cancer was. So like I find our healthcare system is not doing enough to put it out there so other people could get educated and know the facts about it.
Gotcha. You want to chime in there, Miss Nancy, about cultural stigmas?
Yes, thank you. Well, in Guatemala, some of the stigma is, in Karla, we share because we are Central America, so we are neighbors and sisters countries. But talking about stigma in Latinos in the United States or in Guatemala, I think like some of the major stigma is like, how can I have this procedure if I'm not gonna have intercourse with my boyfriend tonight? How can I explain that, right? Fear. And again, feel shame. And I remember having a patient, again from the Caribbean, skipping the lip procedure. And when we talked to her, why is the reason skipping the lip procedure? That was the answer. I don't know how to explain to my boyfriend that I cannot have intercourse for 1 month. He will kill me. Says, how about if you bring your boyfriend?
Wow.
And we started to educate partners. And I believe that we had to involve more men in this conversation, not just women.
Right.
We need men at the table. We need more males here because we can educate them so they can support patients. So that day, she bring her boyfriend, and he was very mad. He was very upset. He almost punched me in the nose.
Oh.
Yep. He's like, what are you talking about? She cannot have intercourse for 1 month. And I just, no, but you know what? Let me bring the nurse and the doctor. They will explain to you. Because perhaps you might have more respect for white cops than me being a Latina talking to you, right? And being a female. And I understand. So, of course, I didn't say that, right? But I said, let me bring the doctors and the nurses. We explained to him, he was furious. And we give him information in Spanish, and we invite him to be in the room for the procedure. He stated, he almost fainted. And later, with respect again for him and dignity for him also, right? We asked him, do you have any questions? Oh, wow. No, don't worry. I understand. It's okay. We don't need to talk. Thank you. I will see you in the car. Don't worry. I understand. And she gets back to us, and the next day I call her. And she says, well, he's furious, but he's okay. And also, I want to share something very important. Then sometimes we have patients come into our clinic with higher risk because they have been sexual harassed, assault, domestic violence. It's not just having HPV. We have women age 25 and plus having, unfortunately, that experience. In that case, we had to make sure that we are being very careful on how we are going to approach this woman having this procedure, because maybe she can have some flashbacks.
Right.
So we are very careful in that matter. And we, when we have those cases, because we analyze cases before we see the patient as a team, we have a protocol and we review all cases. And when we have those situations, if we have a female resident, we need to have a male resident, we have to have a female resident for that patient, just to make sure that she's comfortable. And before she has the procedure, I ask her, are you comfortable today having this procedure? You want me in the room? You want to talk about ice cream by the time you're having the procedure? Ice cream? Yeah, why not? Okay, let's do that, just to reduce anxiety. And after that, I also ask them, what are you gonna do today to treat yourself? Because you're being brave, encouraged to having this procedure. Do you have any plans to treat myself? I didn't think about it. Well, you should. You should treat yourself, right? So we are empowering not just about HPV, but also about self-esteem.
Thank you. So, Karla, real quick, Do you guys have navigators in Honduras?
No, we don't have navigators. It was kind of hard going through it because I actually talked to my doctor if there was a way that I could talk to someone about what was going on, and not even patients wanted to talk about their diagnosis because you say cervical cancer and they're like, no, not talking about it. I don't want anyone to know about it because it's shameful. And one of my doctors told me, oh, your boyfriend's cheating on you. I mean, those are the types of answers sometimes we get. So when we change the narrative and tell them, I don't really care if he cheated or not, I want to talk to someone that has to go through this or has gone through this. Sometimes changing that way of talking about it can help change the stigma around it. So we don't have patient navigators, or at least when I was in treatment, it was just me, my doctor, and my family.
Gotcha.
I'm sorry,
Okay.
Carla, ¿cómo estás? I just want to
Hola.
share, hola. I just want to share with you that last year we trained 4 navigators in Honduras from the Fe y Esperanza Foundation, but I will connect you with them. But yes, we have 4 navigators right now in Honduras.
Great.
And I think this is so important. I wanted definitely, I love Miss Nancy. I said that Miss Nancy is like my bestie over there. But I loved my nurse navigator, and I had another navigator that would come in the room with me. And why it was so important for me, a little bit about just a little bit. I know we are closing in on our time and going to the next session. But one of the reasons why a nurse navigator was so important to me, my chemo oncologist was very short with me, really wasn't explaining the information that I needed, didn't explain to me what a port was. It was just like I was supposed to just know this. Having the nurse navigator there, or having the navigator, literally, they would say, stop, explain it. Explain what's going on. Explain to her what the next steps are. And literally, I don't think that I would have continued with my treatment. And just because of how I was being treated, I don't think that I would have continued moving forward if I didn't have that person in place. And so I'm just saying, for anybody that is going through treatment, or you have to go back to the doctor, ask and see if they have a nurse navigator there, or some type of navigator. I was going to say navigator system. That probably doesn't make any sense. but but they are so important because it will help you literally get through your treatments. Does anybody have any questions for the panelists or anything? Okay, so I can jump up and run down there. Listen. Okay, go ahead, Miss Tiffany. But I come to the front.
For Zoom.
Yeah, because I forgot about that. Come to the front for me. No problem.
Hi, ladies. Hi, ladies. So this question is for you, Miss Nancy. So, because sometimes, right, because where you are at Dana-Farber right now, the referral process, I want to say maybe a little more seamless, right, to get to the GYN oncologist. What do you think the importance is for community partners, where the OBGYN, like Karla said, may not, or, like you said, may not even want to recommend you to go somewhere? Like, what do you think the importance of educating primary care and, community OBGYNs in terms of getting that referral to get to the patient navigator to help you through that journey?
Thank you. Yes, I understand that sometimes getting to Dana-Farber, can be like a delay. I understand that. And no, any system is, we don't have a perfect system. And that's why we are here, right? That's why we have navigation. But going back to your question, community partners. Yes, we are community. Right now, we are actually partnering with a lot of community health centers in Boston. And Dana-Farber is expanding to address those issues. We also have another patient navigation program recently new, specifically at Dana-Farber, to work with specific cancers. My program is to work with higher risk pre-cancer to connect in case we have a cancer patient, we connect to those other navigators. So those navigators also are doing some type of outreach, educational, contact with the community. I believe in navigation, and I had the privilege to talk to Dr. Freeman in last September, and I says, right now, navigation, I don't think so. We had to focus just on cancer. We need to go and prevent. We need to go back to the community and educate. So we can use navigation for that also. Thank you.
Any other? Okay. I see a question right here in the center. Is somebody? Hold on. I got it.
Hi, I'm Travis Michelle, and I'm also a registered nurse going to becoming a patient, right? And it's such a crazy experience. But one thing we don't talk about when we talk about our stigmas is that a lot of women do not go for their checkups or follow-up, as you were stating, because they were sexually assaulted. And it may not have been recent, it may have been earlier. I'm one of those, and I was 16 and trafficked from 16 to 17 and a half, 18. And so I have flashbacks, and I'm a registered nurse, and I had not been to my GYN in a decade. So when I was asked, I was fortunate. My team was like, we don't care if it's 20 years, we're here to help you now. But they did have on the form, and that's what I want to ask, if at Dana-Farber, when I went to my GYN, before I got to the oncologist, they had a question that asked, have you been sexually assaulted? And I think that alone makes a huge difference, because one, I was like, oh my God, they care about me. Like they really care that happened. And the way my doctors approached me was different. So I want to ask, do they have that at Dana-Farber, and for other doctors or hospitals here? Like, that's so important to add that one sentence on your form.
Yeah, thank you first of all, thank you for sharing. Thank you so much. And yes, we do have the question at Brigham also, not just at Dana, but we have an assessment. And we also ask you if you are safe at home, if you're having domestic violence. We also ask not just about that, but practical barriers, social determinants of health. So every time patients call to our clinic to make a new appointment, the person who make that appointment has to ask those questions. What kind of barriers do you have? And we also have a safety net program with Dr. Sarah Feldman, the director of the clinic, and Dr. Berkowitz. And we implemented that 2 or 3 years ago, the safety net. So the safety net is connecting with general GYN, right? Women being pregnant, having regular checkup at the regular GYN. So the safety net program is to connect that clinic with our clinic. And if they have a red flag in their clinic, they call us. And if this patient needs to follow up with us, we contact her immediately. And we assess barriers. And if she has barriers, now it transfers to me. And my job is to follow up with her until she gets to our clinic. Even before the appointment, we assess those barriers and we provide resources.
Okay, we're gonna do one more question. That's it.
2 quick comments. One, to add on to that, Brigham and Women's, I didn't have the exact same experience, but I had a medical trauma with a gynecologist, and the doctors asked me about it. And once I've told them, I have to say every single appointment, he sits with me and he says, are you okay with this? I know, and he brings up the thing and he says, I know you went through this. And not only that, when he forwarded me to another oncologist that was going to give me a pelvic exam, he told her ahead of time, and she said, I know about your trauma, and I just let you know I'm listening. So they are amazing, not only on forms, but every appointment you have. And I just wanted to add, I know yesterday I was surprised that that department existed, but in every other sense, I want to say Dana-Farber I've had everybody calling me. Like, I had someone call and they were like, do you need any financial help? And I said, no. And they were like, are you sure you might qualify? And I had nutritionists calling me. Like, I had so many people calling me. So while I know yesterday I was surprised that fell through the cracks, overall, all the other
resources were offered to me. So, and like you said, there's just so many resources that I think that I just kind of didn't, and they might not have realized I needed that. So I just wanted you to know that I am offered that. I've been offered so many services and you guys do an amazing job there. And
Thank you.
Thank you. Thank you. So that ends our session. So we're going to give it back to Miss Christie. I know you got up like 3 times, but it's time now. It's go time. It's not?
Take a brief moment, if you would, and quick stretch. We're going to get started here. We're just fixing a little technical issue.
Okay. Yes.